your life.
Hey guys, we're back. So we are going to show you a little bit about TruSculpt. So this is a great treatment for fat reduction and skin tightening. So I'm going to show you a little bit of the setup, and keep in mind that there is some finagling with it. Every patient's very different. Their distribution's different. Their size is different. So how we place these applicators is completely customized. That being said, we're doing a lot of treatments for the arms. It's phenomenal. And for someone who's smaller, it might just be 2 applicators along the back. For someone who has a little bit more fat, we're kind of sandwiching this front and back portion. So that's sort of hard to secure, and you'll see some of how that prep work gets put in. But I also am able to take applicators and wrap around the back of the arm to get this bulge that kind of comes out from the bra line, and it can be very uncomfortable. So first things first, we're going to connect her grounding pads. The grounding pad essentially makes sure that the current does not flow freely through the body. The radio frequency is going to be focused on the applicators where we place them. So she has 2 grounding pads. They can be on the thighs or on the back, so they're connected. That's ready to go. We're going to then take, I'll just kind of maneuver you as needed. Rest your arm off to the side, and then this one you can have here. So we have these sticky rubber binders that secure our applicators in place. And so we're going to bring this over here for a second. Come on this side for me, please.
And what's this procedure called?
This is TruSculpt ID. It's by Cutera. So it's a new device, but it's not newer technology for the company. They had TruSculpt 3D in the past, which was movement-based. This one now you can either move or have it stationary. And there's the large applicator as well as a very small applicator, which is great for this area or for the submentum. So it's newer and better, but technology that works. So the next step here is we're going to take our stickers and place them on the area that we want to treat. We're going to be doing 4 applicators right now, 2 on the front and 2 on the back. So we're going to just stick these on. So these sticky stickers are made to protect the skin and to make sure that our paddles stay completely adhered to the skin in the area. So we're going to have that one applied on the front, lift up this way. We're going to put one on the back as well. Okay, here we go. So skin protection and securing our treatment area. And then rest your arm right on your shoulder there. Okay. So now, can I have 1 and 2? So now you can see that this is the area that every woman is going to say it bothers them. That we're pinching. What we're going to do is apply these pads on the inner and the outer portion so that we have dual-sided treatment. And that's how we really maximize the results from this. Bend your arm for me, hold it right there. So the TruSculpt treatment is 15 minutes from the time that everything is applied and secured. And the temperature is going to build up to about 44 degrees. That is where you're really starting to have a nice effect on the fat cells, on the collagen fibers. And it's very comfortable, just sort of feels like a heating pad. Certain areas are a little bit more sensitive than others. So, rest your arm. Push the reset. Good old reset button. All right, hold your arms straight. So this is where the 4 hands come in handy because we want to make sure that this is good and secure so that it does not move, and it maintains great contact with the skin for the most efficacy in our treatment. Now replace your hand on this side. Okay, great. And this is one of the more complex areas for setup, but for the abdomen it is much, much easier. There we go. How's that feel? Is anything pinching? Okay. So now you can just rest your arm off to the side here. Is that okay for right now? Great. So now if you'll follow me over here, I'll show you the interface. So we have here TruSculpt ID. It's our current patient. She's female. We'll pick her age range, height, weight, moving along. We can select our number of applicators. It's going to start at 43 degrees. Because the inner arm is a little bit more sensitive, I always lower the temperature down. And now we're going to warm it up and start the treatment. So with this, even though you can have up to 6 applicators on at a time, only 2 will be actively heating the skin at a time. So 2 of the 6, numbers 3 and 4 of the 6, 5 and 6, and they will toggle back and forth as they build up heat in the skin and then give it time to relax. So our device is ready. It's going to turn on. Now 1 and 2 are starting to heat, and you can actually watch the numbers here start to fluctuate. So we're at 33 degrees, 33.5, 34, and it's going to increase until we hit our goal temperature of 44. We'll have 15 minutes on the clock, and at that point, most patients are sweating. They're just a little bit red. Nothing is terribly uncomfortable at all. The redness is gone in about 30 minutes. And you're free to do anything you want afterwards. You can work out, you can go in the jacuzzi, you can just take the day off and hang out knowing that this is going to give in that work for you. But it's a great treatment. So she's going to get the tightening in this area and the fat reduction. So that's TruSculpt. We'll leave her for 15 minutes. I'm going to increase the temperature according to her comfort level, and then we'll see how she's feeling. Thanks for watching, everyone.